Welcome to the Medicine and Science podcast from the BMJ. I'm Cameron Abbasi, Editor-in-Chief. Coming up in this episode, we'll hear more about the new NHS England changes and what they might mean for care.
You can well understand why politicians might say, well, let's get rid of NHS England and let's take much more direct control. Politicians come and go, and there's no reason to suggest that they would know how to run the fourth biggest organisation in the world.
How the New World Order is shaping up.
There is an enormous shift, and that shift is not really value-based. Human rights, equality, global goods, they are not driving the agenda anymore.
And how supporting adolescent nutrition is key to healthcare improvement in South Asia.
And if you take girls, that's about a quarter of the entire population, 350 million we estimate. That's not a demographic that can be ignored, and it will never allow the region to rise above its current quagmire if you ignore such a huge section of the population.
Firstly, the UK's Prime Minister has announced changes to NHS England, yet another round of reforms. What might this mean for the functioning of the health service? Our producer, Duncan Jarvis, spoke to Nigel Crisp, former Chief Executive of the NHS and one of the BMJ's commissioners on the future of the NHS.
My name's Nigel Crisp. I worked for the NHS for precisely 20 years, between 1986 and 2006, and I was running the NHS and the Department of Health between 2000 and 2006.
And you're one of the people that we go to find out about, how NHS and politics is integrating. And that's why we're on today, because the UK Secretary for Health, Wes Streeting, has announced that they're disbanding NHS England. Now, for people outside the UK, that doesn't mean disbanding the NHS in England. NHS England is the body that oversaw the NHS, its functions, and sort of led on it. And now these reforms are getting rid of this arm's length body and bringing some of that back into the Department of Health and Social Care. And Nigel, you've seen some reforms over time, particularly the Lansley reform that created NHS England in the first place. What was your reflection on what's happening here?
What happened with the Lansley reforms, which were, I guess, 2010, 11, 12, and creating in the NHS England in, I believe, April the 1st, 2013, was an attempt to create a quasi-independent headquarters for the NHS outside the Department of Health. And this was the sort of idea that you could take the politicians out of the management of health, which is and the issue here is that you don't want the politicians to get involved in managing and in the day-to-day management and in sort of diving in anytime anything goes wrong and interfering, if you like. But you do need the politicians for working with the wider public, for managing the public, for managing the politics, for integrating with other departments and so on. And the trouble is, when you create a sort of quasi-independent organisation called the NHS England to run the NHS, you've then got the Department of Health monitoring NHS England, and that creates some duplication. But you've also got NHS England monitoring the NHS. And really, NHS England got squeezed between the Department of Health and the NHS and was deeply unpopular both ways, I think. But it had some great expertise. And this is the place where you'll find, NHS digital and data, for example, if you want to think of something like that. It's a place which runs the workforce planning, which is incredibly important. It's the place which deals with most of the international relationships, international partnerships and international learning, and a whole range of other skills. So getting rid of it means that the NHS is coming back into the department, and there are some risks in that. And if it would be useful, Duncan, I could just talk about where I see the risks in all of this, but also then go on and talk about the opportunities.
Well, I think that would be good because, when you were on last time, you were talking about the health and care emergency, and maybe we'll get to that. But the NHS is very beleaguered at the moment, and people are worried that this, reorganisation is coming on the top of the pressures that the NHS are under.
Yeah. Well, we've had quite a lot of reorganisations over the years in the NHS, and you know what happens is that people start to get worried about their own jobs. And people lose focus, you lose time and you lose pace, and that then knocks on to achievements and so on. And you can spend an awful lot of time wasting time of reorganising yourself instead of getting on with the job. But there's another big issue here of morale. I thought the way that the Prime Minister introduced this by talking about the checkers and blockers. Now, that's not exactly, we're saying that 10,000 people in NHS England are checkers and blockers, including all those clinicians, the chief pharmacy, people who are moving on the prescribing reviews and all that kind of stuff. I mean, this is a bit insulting, really, so I can only imagine how people rather feel about that, and they will be naturally worrying about their jobs. But it's not just for their sake I say this, because you also start, every time you have a reorganisation, you lose some of the people with the corporate memory who know what has been done before and what has failed before, and you sort of go back to day zero in terms of learning. So the confusion and the chaos that comes with it will be around for some time, however well you manage it. So there's some real risks there. And then bring it back into the department, you're going to have to then re-establish the relationships between the Department of Health and NHS England. And that, of course, will also distract what the Department of Health does, which is a whole important agenda, including, of course, social care. So there are some really quite significant risks around this. I'm sure they'll manage it as well as they can, but there will be some losses. So the important thing is also to think about what gains they may get. And the gains which the Prime Minister and the Secretary of State talked about, of course, were financial. They were basically saying it stops duplication and gets rid of unnecessary overhead. Well, as you've already gathered from what I've said, I thought NHS England wasn't a good idea, really.
No.
It was always going to be squeezed between the people with the real power, which is the politicians, and the NHS.
So you felt this was quite inevitable now or at another time?
Well, in the end, it comes down to relationships, and you can't design systems that will always work. You can have good people and poor systems and it'll work, and you can have good systems and poor people and it won't work. And it's about relationships. And what we needed to do was to make sure that the politicians, the senior people in the system, and the NHS all had some level of trust, some recognition of the same direction. We haven't yet got a vision for the NHS that is presumably going to come out with a new NHS plan. My history in the NHS isn't actually as long as some people's, but this is undoubtedly the biggest crisis in my time. When I became Chief Executive of the NHS in 2000, there was another crisis, and it was a serious crisis, and people had lost faith in the NHS, and people talked about managing decline. And one has a sense in recent years we've gone back into managing decline in the NHS, but it's a bigger crisis. The waiting lists are higher, the problems are greater, the financial crisis is much worse, and so on. So it's a real crisis. And in those conditions, you can well understand why politicians might say, well, let's get rid of NHS England and let's take much more direct control and let's find a better way of organising this. When they do that, of course, you've still got to try and make sure that, politicians come and go, and there's no reason to suggest that they would know how to run them, the fourth biggest organisation in the world. So you don't want to include them directly in the management of it. But on the other hand, the policy setting, the directing, the holding to account, and doing a whole range of other things that are important are needed. So you've got to get the new relationship right. There's no easy system design. You can't design this by systems and then tell people how to do it. It's about people. The NHS is all about people, of course.
Yeah, absolutely.
But what I think they need to do is the intention is that they will launch a new NHS plan at some point, and June-ish perhaps is the sort of timing, which I hope will set out a vision. I hope it will set out a route map. I hope it will show what they want to do. They have talked, this is the politicians, about this being a less centralised system and giving more authority to the front line. Well, let's hope they don't too over-constrain the front line. But I think they should at the same time say, look, this is a national emergency. This is a national health and care emergency. We're in serious trouble here, because we are in trouble. And we need to get everyone who can help to help. And we know that many of the things the NHS deals with are nothing to do with, are things that the NHS can't control. But actually, health depends on all of those things and not just on having a decent health and indeed care service. So that's the way which the politicians can drive that sort of vision. Others have to deliver it, of course, but actually they could do that. There is a great African saying I quote a lot, which is health is made at home, hospitals are for repairs. So actually we've got to be in the business of making health as well as dealing with the repairs.
And you feel like this is potentially a positive first step towards doing some of that then?
The future depends on people. There's an awful lot of nonsense talked about systems and structures and so on. Systems and structures are useful. You need them. But actually, you need people to be pointing in the same direction. You need people to be working together. What you've got in the NHS is what John Reid, one of my Secretaries of States, used to describe as the greatest army for good in the country. In the end, it's people who are going to make the difference. And I'm sure that the people trying to design the new way things will work will be thinking about how they can give people as much freedom as they can in order to make a difference, because people join the NHS, people go into the healthcare professionals largely, not entirely, largely because they want to make a difference in the world. And we all know that. And that's the point that I think John Reid was making. How do you make that happen?
Great. Well, Nigel, thank you very much for joining and explaining what's going on.
Thank you.
Nigel has written for us on these reforms, and inevitably we'll talk more about the future of the NHS when those plans are announced. Stay up to date by subscribing to our daily email alert, links in the podcast text. Since Donald Trump announced the US's intention to leave the WHO, both the funding it provided and its political influence on global health is waning. So, who or what will fill the gap? Here's Duncan Jarvis again talking to Illona Kickbusch, one of the most respected commentators on WHO and global health.
I'm Illona Kickbusch. I'm a professor at the University of Geneva and at the Graduate Institute in Geneva. I do a lot of work in global health, also with the World Health Organization, with the European Union, and many other actors. And I've published a lot in this area.
And that's the reason we're talking to you, because it feels like this is the time, certainly within my experience, and I wonder about in the same as yours, of potentially the greatest turbulence or change to the structures of, the UN, the WHO, and so on. Does it feel the same to you?
It is definitely very disruptive, and it's interesting to see that another disruption that, of course, was enormous historically, meaning the fall of the Soviet Union, did not have this amount of impact on multilateralism, whereas this time around, there is a real disruption, and part of that, I think, is due to the fact that what we have called the West, which has sort of existed since the end of the Second World War, is now broken.
The impression I got when you were speaking earlier, when I saw you talking, was that although this is a big disruption, the breaking, as you say, of that Western alliance is perhaps not happening in the way that was expected. Some of the underlying forces, some of the underlying problems were always there, and some of this realignment didn't feel entirely surprising to you.
Well, it was definitely the case that the American hegemony and a certain basic mindset that ran the world through this hegemony of neoliberalism, for example, that this no longer held. And of course, this enormous disruption is something we feel in Europe, in the West, but there's a whole world out there. There have been big disruptions in some of these parts of the world. There have been revolutions, there have been wars. The wars are ongoing in Africa. So as one then sees in the discussions of the UN General Assembly, for example, for some countries in that part of the world, this does not seem so incredibly important at first instance if America and Europe don't get along anymore. And basically also what the Trump administration takes as its diplomatic guide, that is, we negotiate a deal. You give me something, I give you something, and hopefully we get the better part of the deal. This transactional diplomacy is becoming much more important. And the idea that there is such a thing which is reflected through the United Nations and what we call a rules-based system, which wasn't that rules-based, but it did give some order, that this is no longer the case. We no longer aim for global public goods. We aim for the best for each part of the world, for whoever the negotiating partner is.
As someone who is interested in but doesn't know very much about these sort of global conversations, global structures, to me it feels like there is just utter chaos at the moment. But you were talking about realignment that's happening. Where do you think we are along that path towards understanding what the new kind of structure, what the new fallout will be?
Well, new structures have been built over the last 20 years. If you just follow the trajectory of China, the way it is acting in Africa, for example, China has been building relationships with African countries since the 1960s. There has been the development of the BRICS countries, and what we're seeing now is the BRICS Plus. There has been dissatisfaction with the Bretton Woods organizations, and alternative banks have been built up.
What are those Bretton Woods organizations?
That is the World Bank, the International Monetary Fund, etc. And so now, we have development banks at the regional level. We have the Asian Investment Bank in Beijing, for example. So we are seeing the inklings of a new order. And we're also seeing that in the way that the big so-called developing countries, the middle-income countries, are acting. Now, many of these countries can play the players. So we don't see clear blocks emerging anymore, but actually the transactional diplomacy, I'll help you here on your supply chains if you help me here on your technology development and things like that. So there is an enormous shift, and that shift is not really value-based. So what we did try through the United Nations, human rights, equality, global goods, all those kinds of things, codified in the Sustainable Development Goals, attempted in the Summit for the Future, they are not driving the agenda anymore. So the United Nations is sidelined.
We're sort of talking slightly abstractly about power here, but that hegemonic power was held partly due to the enormous amount of funding that the US put into the global health system. And, there are now fears that the disappearance of that money will lead to many deaths. And I wonder, are those other countries, will that money come from elsewhere now?
I think it's going to be a breakdown of that financing system. When the first Trump administration said that it would leave the World Health Organization, the European Union jumped in with funding for the World Health Organization and, saved its budget to some extent. This is not going to happen this time around because, first of all, Europe is financing the Ukraine war, but also Europe has set other priorities for itself. I personally believe the global health arena should have been much better prepared for it. Of course, nobody was prepared for this drastic reduction. And as you said, this drastic reduction, of course, kills people. People are dying on the ground in Africa and other countries. Major programs are endangered. We don't know the extent to which polio might come back, etc., etc. So this incredible disruptive force is killing organizations, is killing people, and is forcing the global health arena, or the global health field, if I can call it that, to analyze what its core functions are and how those core functions should be financed.
When change is needed, giving organizations time to reconfigure, to rethink their funding models, to rethink their service provision, can allow, a transition to happen. But that's not what's happening in this case. So do you fear that these organizations will just crumble and nothing will be built in their place?
Well, one can, of course, ask, did we need all those organizations as well? And, for a longer time, there have been suggestions, take UNAIDS. Do we still need UNAIDS? Should it be combined, for example, with the Global Fund? So what we will see, I think, is some of the smaller organizations maybe crumble or being forced to combine with others. We see big problems for non-governmental organizations. They were already experiencing political pressure. Now that is being increased through the financial pressure. In Geneva, an incredible amount of people are losing their jobs. Developing countries relied on this money for their health systems. So if it's gone, they will have to look at their national budgets again and take new decisions of priority setting. But then the question is, yes, who else is going to supplement that? And it will no longer, to that extent, come out of the UN system in a variety of ways. So this will lead to a very, very big change. And, of course, open the door for private investment, which can be both good and bad. It can lead to, a significant privatization of health, which is already the case in a number of developing countries. But it can also lead to investments that create jobs in terms of, a pharmaceutical industry for Africa, diagnostics industries, those kind of things that can be very, very important and lead to a total redefinition of supply chains and production chains.
It seems like in the Trump administration, individuals with enormous amounts of money and power are playing a huge role in the decision-making they have. You've talked about this sort of realignment and multipolarity. And do you see private money, private finance playing a greater role, having more power in that system?
Well, definitely the tech companies will have greater power and already have very major power. And here again, speaking of normative organizations, the balancing act, how does, for example, an organization like WHO work with the tech industry if at the same time it should actually be setting norms and standards? Because, that's the situation you've had for the last 50 years with the pharmaceutical industry, where WHO has been setting norms and standards and safety of medicines and access to medicines, etc. We actually need a similar process in relation to technology. But much of this has become incredibly geopolitically defined, as you indicated. Who has the rare earths, who has specific materials. It used to be oil, now it's something else. Drive the agenda, and many people don't realize how close they are to global health. What we really have to see the extent to which trade agreements, economic competition, tech competition are actually now defining global health. And we need to understand that in a totally new way. It reared its head through COVID, where we saw, we're not that ready to share things. Thank you very much. And using also the access to the vaccines for geopolitical reasons and many other things. And we're going to see more and more of that. So I think for a significant period of time, there is not a strong will to move towards a global public goods agenda.
Yes, I mean, the whole picture you've sketched out is just this move from that sort of soft power way of thinking about things to a much more transactional, mercantile, potentially, way of thinking. Just to finish, I mean, what are you hopeful for and what are you fearful of?
Well, fearful of course, the impact this rapid disruption is going to have on many people and individuals. I mean, people are dying because of this. The opportunity, of course, lies in having the courage to rethink this system. And we do need to rethink it, but we also need to rethink it from the perspective of the other. Because I think the whole discussion we've had around decolonization of global health, etc., has, of course, been built on the critique of this model of a donor-based approach, where approaches and priorities have been defined by the old colonial powers. And the mindset was that of the old colonial powers. So now, to some extent, and that also applies to how should WHO be run in the future, etc., the question is, how will the other step up now? And this is the opportunity for the Global South to define what global health should be.
Finally, the BMJ has a new collection. It's called Nourishing South Asia, and it's in collaboration with UNICEF and their regional office for South Asia, as well as the Deakin University in Australia. Jocelyn Clark, our international editor, spoke to Zulfiqar Bhutta about the importance of tackling the triple burden of adolescent girls' nutrition.
Hi, I'm Jocelyn Clark, the international editor of the BMJ, and today I'm delighted to be talking about improving adolescent health and nutrition in South Asia with my friend and colleague Zulfi Bhutta. Zulfi, do you mind introducing yourself?
With great pleasure. I'm Zulfi Bhutta. I'm the chair in Global Child Health and Policy at the Hospital for Sick Children's Centre for Global Child Health in Toronto. I also head the Institute for Global Health and Development across Aga Khan University campuses in South Central Asia and East Africa.
What brought us together to talk today is the BMJ's publication of a new collection of articles about adolescent girls' nutrition in South Asia. And I think this new concept that lays out the fact that there is now a triple burden of malnutrition, undernourishment, rising obesity and overweight, along with anemia among girls. So from your point of view, in South Asia, being an adolescent and nutrition expert, why is it so important that we look at the issue around this triple burden among girls?
So if you look back at some of the analyses that have been done around nutrition amongst young women, the reason why anemia, the reason why some of the adverse consequences of undernutrition in pregnancy have been highlighted is because so many of these young girls are married off before the age of 18. And as we point out in our editorial, if you estimate, close to around a fifth of all births in South Asia are in this age group. And now, if I may underscore one final point in this preamble, we face the egregious challenge of girls being denied their rights for education in many regions. some by default because the system isn't geared to providing equal opportunity to young girls, and some by design, by governments principally denying girls the right to education from a very young age, leave alone during adolescence. And that compounds many of the challenges that we face around health and nutrition in this age group.
Yeah, as you say, it's absolutely striking to learn from this collection that roughly half the population in South Asia is under 18, with more than 350 million adolescents living in South Asia. Such a large proportion of girls are married as children, and as you said, almost a fifth give birth before they're 18. So the health and nutrition requirements and challenges are huge. Talk to us a little bit about what challenges are presented for girls and young women in this region who do have pregnancy so young. What are their health and nutrition requirements, and how has that changed with the changing kind of social and regulatory environments that have really changed the availability and access to food?
If you take anemia as an example, we find that the rates of anemia in school age and young adolescents are very high because of the combination of things like poverty, food insecurity, and also poor dietary choices. And they are compounded by pregnancy, because pregnancy places an undue demand, just like for a young girl entering puberty and menarche places a huge demand on extra need for iron and other nutrients. So pregnancy just doubles, triples that in many instances. We recently did some analyses across South Asia, particularly for the two countries where we have nutrition surveys, Afghanistan and Pakistan. And we found that as a driver of childhood stunting, which is a big marker of undernutrition, maternal height and maternal BMI were independent drivers. Now, BMI, body mass index, reflects acute nutrition in pregnancy, but height is the reflection of not only just what the mother was as a child, but probably her mother herself, the grandmother. So that's the cycle of undernutrition that you get into. But let me finish by saying this is a region caught in this vicious cycle of ignoring a demographic that you pointed out is 50% of the population. And if you take girls, that's about a quarter of the entire population, 350 million, we estimate, right? So that's not a demographic that can be ignored, and it will never allow the region to rise above its current, quagmire of poverty, deprivation, inequities, if you ignore such a huge section of the population.
One of the merits, I think, of this collection that, I find very pleasing is that the authors have laid out a kind of toolbox or roadmap for interventions that can act on those broader determinants of health and better nutrition that you describe. So if I could then sort of talk to you a little bit more about the regional approach that you mentioned at the top. We know that we need to see change at the level of national governments and their regulatory powers to, curtail the activity of food companies, for example, marketing to children, food composition, etc. But you did mention the regional approach, which might gain traction here.
But these political determinants of health are challenging. They're challenging because the region has just not been able to organize itself for a lot of reasons, including geopolitics and regional politics, into a coherent working group, even though it's probably in terms of population, one of the largest aggregation of people in the region. So we currently don't have a functional SARC secretariat, which could bring ministers of health and ministers of planning, and for that matter, social development together, which I think is what I was alluding to, that some of these lessons to be learned from each other. And in the case of big countries like India, from within regions of India, are things that need to be looking at. Secondly, I think now the imperative is even stronger, with the current global environment of vanishing, development assistance, and it's not going to change in the immediate or short term. That's the ground reality in many places, that countries will have to wean themselves off external support and increasingly rely on themselves. So when you have to have that self-reliance, then you need to learn from each other. This South-South collaboration should become the norm rather than the exception.
So on the basis of that, if I could just ask you, with so much political change, chaos and disruption that is, as you've just described, creating gaps in available resources and certainly in foreign aid assistance, can South Asia seize the opportunity and think about reframing the narrative, reframing the way that they're going to advance health and rights in the region? Where do those opportunities lie in your mind, and what's giving you hope in 2025 for us together to advance this agenda?
So I think that's an absolute essential, Jocelyn. And this is the opportunity that we need to grab, as I said, to stand on our own feet, stand as a region, stand together, and try and see what could be transformative. I will say one thing, though. Those of us who are parents, who have seen our children go through adolescence and reach adulthood, recognize full well the importance of their own voice, their agency, their ability to stand and be counted, and also point out to people that they will, in a couple of years, be a voting demographic, that their vote bank matters, and therefore getting them involved in this discussion, debate, in talking about what are their rights, what are their challenges, and what can be done to produce pragmatic solutions is something that we should actively do. So I would very much like to see adolescents as part of this. We should not be talking for them only. They should be very much part of the discussion, and that will require time and effort, and that will require also advocacy at a societal level. And who's going to take those steps? Some of those steps, Jocelyn, I feel very strongly for adolescent health and well-being, nutrition being very much part of it, are things that governments cannot do anything about, because they have to do with mindsets. They have to do with civic society recognizing the rights and importance of doing things appropriately for girls the same way as they do it for boys. And there is no question, it's a patriarchal society in South Asia, but it can change. And the biggest advocates, I think, for change are going to be these young adolescents themselves. Please remember that, within the region, youth and young people have been harbingers of change at a national level.
All of the papers that Jocelyn and Zulfi talked about are now freely available in our collection, Nourishing South Asia, and that's on bmj.com. That's it for this week. We'll be back again next week with more about MAHA, the Make America Healthy Again movement, and the so-called age of diagnosis that's looming on the horizon. Until then, thanks for listening.